Today is not so much about the bag change. I'm here to answer questions about my stoma. I've been asked many times if it hurts, what it feels like, and do I know and can I feel when I'm having output or when I'm passing gas. So I'm going to answer those questions as best as I possibly can today. Now first, no, it doesn't hurt. The stoma doesn't hurt. It doesn't have nerve endings. There is some feeling around it from the inside, I would say, from the inside. Some people describe it like how the inside of your cheek, inside of your mouth feels, but I don't describe it that way because if I bite the inside of my cheek, that's gonna hurt. If I touch or pinch my stoma, it doesn't hurt and I don't actually feel that. So a healthy stoma looks like this. Basically, it's supposed to be pink and shiny looking. So if you can see, that's why I'm off camera so you can get a better look. If you can see, it's shiny. It's shiny and it's pink, and it is also trying to have output at this time. So bear with me on that. So now the stoma, if there is some pain, it's going to be pain around the stoma because of skin irritation, or it may be something on the inside of the abdomen that's causing pain. But the stoma itself does not hurt. It doesn't have any nerve endings, and I can touch it and I don't actually feel anything. Now, there is some pressure because just say I'm having thick output, so when it's coming out, I'm gonna feel the pressure of it, but it doesn't hurt. Sometimes I can feel it when I'm having output, and sometimes not. Sometimes I know when I'm gonna pass gas, but most often not. I'm always gonna basically hear it, and I can feel it from the inside once it's happening, but most often I never know when it's coming. When I can't feel that I'm having output, I will know it by the weight of the bag. If I'm having, like my experience with the B complex, when I was emptying out a lot, I could feel the pressure of it coming out because it was coming out rapidly. But for the most part, no, it doesn't hurt, and it also bleeds sometimes. And I'm gonna try to get as close to the camera as I can. I don't know if you can see that, but there is a little spot of blood right there, which is normal. The stoma is very sensitive, and because of the blood flow, and because it can sometimes get nicked, or it's very sensitive to the touch sometimes, and you'll have a little spot of blood. If there is constant bleeding, then that's a problem, and you would need to consult with the physician. If you have discoloration, if the stoma is purple or black or really dark red, then at that time, that's the time to consult a physician because something is definitely wrong. And my stoma is active right now, and so this is a moment when I didn't know that it was coming. And sometimes I couldn't feel it when it was coming out, but because I'm looking in the camera, I could see that it was coming. I think that I have covered it all. This was just a quick video to answer those questions about whether or not my stoma hurts or if I feel pain or anything like that. The stoma does move. It is alive and active, as you can see, and sometimes it lays flat, on itself. It lays flat, and sometimes it pokes out, it sticks out. So it does move, it does change sizes. You just never know when it's gonna be active. I pretty much have a schedule or awareness around when I'm gonna have output, and sometimes not, like now. And so it's actually moving right now. It's poking itself out and going back inside and kind of leaning to the side a little bit. But I hope I was able to answer some of your questions. Like the shares that I do on this channel, consider subscribing. It's a safe place and a safe space, and you're welcome here. In the meantime, I will see you in the next video.
Living it stronger every day, living it, finding my own way. Colostomy life, I say it plain. Colorectal cancer didn't win the game. Living it confident and brave, living it with Sandra Jane.